TV. The world is thinking.
The proportion of GDP that goes to healthcare, is that overallocated?
Well, the U.S. spends 17% of GDP on healthcare, and you drop down to number 2, which is Switzerland at 12%. And so you say, well, hey, what do we get for that? Well, we get nothing. The health outcomes, which are complicated to compare, but the health outcomes are basically slightly worse, both in terms of averages and the inequity. Our bottom quartile is very ugly compared to all other rich countries' bottom quartile. Our upper quartile is somewhat better, but that's how you get the inequity. So we're spending at a huge rate, which if it wasn't increasing faster than inflation, it's increasing as a percentage of the economy, then okay, you can probably afford it. But as it continues to grow, it squeezes, unless people say, yes, I would like to be taxed a lot more, and most states have these supermajorities that are required to do that, and it's not likely, and it's not clearly a good thing either. But as long as you're dealing with a finite amount, as the medical cost goes up, and that shows up both in state budgets as so-called state Medicaid spending, and it shows up in the federal budget as Medicare, and they're part of Medicaid, it squeezes out everything else. So right now what you see is it's squeezing higher education. You're raising tuitions at the University of California as rapidly as they can, and so the access that used to be available to the middle class or whatever is just rapidly going away. That's a trade-off society is making because of very, very high medical costs and a lack of willingness to say, is spending $1 million on that last 3 months of life for that patient, would it be better not to lay off those 10 teachers and to make that trade-off in medical costs? But that's called the death panel, and you're not supposed to have that discussion. So of course,
well, that's an interesting thing you just said, which is just the last 3 months in life for one person or something, because we haven't had a discussion of how to allocate that money. It means we lay off 3 teachers to do so. I mean, in other words, we haven't had this type of allocation.
We're making that trade-off because of huge medical costs that are not examined to see which ones actually have no benefit whatsoever. And because of pension generosity, we will be laying off over 100,000 teachers, which, I'm very much against that. And the whole AFT will agree with me on that.